Greetings. I'm Dr. Jerryl Banait from Nagpur, Maharashtra. In India, acts of violence against the healthcare professionals acts as an impediment to the smooth operations of the medical facilities. Also, the fear while working takes a toll on the healthcare workers emotionally. I filed a public interest litigation in the Honourable Supreme Court to get police protection for all healthcare workers in the country. Noting the unavailability of effective protective measures for healthcare workers, the Honourable Supreme Court in Dr. Jerryl Banait versus Union of India, wide order dated 8th April 2020, directed the government, union and states to provide police protection to all medical professionals. The police protection was extended to the medical staff who would visit the places to conduct the screening of people. The court further directed the states to take necessary action against those persons who obstruct medical professionals in discharging of their duties. The directions of the Supreme Court prompted the Ministry of Home Affairs to issue a memo dated 11th April 2020, followed by a memo dated 22nd April 2020, directing the Chief Secretaries, administrators of all states, union territories to take necessary action to ensure compliance of the orders passed by the Honourable Supreme Court. In the meanwhile, the Ministry of Health and Family Welfare published draft measures for ensuring the safety of healthcare workers during COVID-19 services. On 22nd April 2020, sensing the urgency of the situation, Honourable President of India took the recourse of promulgating the Epidemic Act or Epidemic Disease Ordinance 2020 as the Parliament was not in session. The 2020 ordinance sought to amend the Epidemic Act of 1897 and was brought into force forthwith. Until passing of the 2020 ordinance, India was hanging on a 123-year-old unamended Act of 1897. The ordinance mentions that if any healthcare professional, which includes doctors, nurses, paramedical workers, community workers, are subjected to act of violence in form of harassment, intimidation, actual harm or injury, or any act which prevents a healthcare professional from discharging his or her duties either within the premises of a clinical establishment or otherwise, which includes loss, damages to the property and documents in custody of a healthcare professional. According to the severity of injury, the accused can be imprisoned for almost 7 years in jail and a fine of rupees 5 lakhs can be imposed. In case of loss and damage to the property, the compensation payable shall be twice the amount of fair market value as may be determined by the court. The trial of the offences conducted under ordinance shall be conducted as expeditiously as possible. Further, when the trial is at the stage of examination of the witness, it shall be conducted on a day-to-day basis till all witnesses have been examined. The provision lays down an upper limit of 1 year to conclude the trial. We thank Honourable Supreme Court and Honourable President of India to pass this amendment in the Epidemic Act of 1897, which is going to be immensely helpful for all healthcare workers across the country. Jai Hind.